So what's my number one tip when it comes to passing clinical finals at medical school? Be a jackass. I'm sorry, what on earth are you talking about, James? Okay, so we know week one medical school, we're going to say the most important thing is the clinical history. You need to understand the symptoms, how the patient might describe those symptoms, how to ask the patient about those symptoms and extract the information you need in order to be able to weigh your differential. And then you do your clinical examination to try and reject some of those differentials, and if needed, go on to do investigations to shore up what you have as your differentials to give the best management plan. But all of that is based upon the structural foundation of the history. So to pass medical school, you focus on your histories in practice with your clinical colleagues, taking histories day in, day out from each other. But where's the jackass part? When it is your turn to be the patient, don't just give the information freely. Make sure that your clinical colleague has to work for that information so that they know how to frame their questions in the best possible way. If they give you closed questions, give them closed answers back. Make them work to understand what is going on with you as a simulated patient. That also works on your side as the patient, because you need to know the symptoms that you are manifesting in your history for your colleague to be able to come up with the differential diagnosis. And I strongly would say that practicing in and out your histories is much more important than any of the other aspects that you'll do outside the physical and clinical skills and physical investigations, because that's a different set of knowledge and how you revise it. But the histories backwards and forwards, and make your histories difficult. Have symptoms on the more esoteric side of the symptom spectrum. When you and your colleagues have done a history to death, as it were, when you know the simple things by heart, you need to increase the difficulty. So be a jackass with your clinical partner, make them work for the history, and I guarantee, A, it'll make history sessions a little bit more entertaining for yourself as the practice patient, but it'll also help both of you consolidate in your head that knowledge that you're both learning at the same time. Take care, and I'll see you in the next one. Cheerio.